Hello and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Zachary Schwartz. In this episode, we discuss hepatitis B care in the United States among people who emigrated from Africa. We'll talk to patients and patient advocates Janet Afoakwah and William Amiteye. We'll also hear from Dr. Patricia Jones, who provides a clinical perspective on the topic. But first, let's hear from William Amiteye, who starts the discussion based on his own experience as a Tanzanian immigrant.
Yes, hi, my name is William Amiteye. I was born and grew up in Tanzania until I moved to the United States 25 years ago. Now, I found out about my hepatitis infection back in 2007, just going through a routine application for life insurance, expecting our first child. And that's when I was asked by the insurance company if I knew when I got hepatitis B. Of course, I had no idea. So it was a very scary moment. I was in shock, a lot of fear, and very uncertain what all this meant. I just knew something really bad had just happened to me. Without any knowledge of where to go, where to start, I went to my office the next day, and I spent pretty much the next week just punching away, trying to find out what this meant for me and if I was going to survive this. Later, I went to my PCP after getting some information from online. Pretty much it was my source. And of course, everything, some of them are very scary. My PCP was not very helpful, of course. She was not intentionally, but she was not really versed with hepatitis B. I went back home and, luckily my wife happened to know someone who worked in hepatitis B. And I was able to get a recommendation to somebody who was about 30 minutes from me. And, and that's where everything started as far as giving me some information. Now, I didn't get a lot of information from him either. He just told me, this is what happens. We'll have to test you. And then we'll take it from there. And of course, I went through a test and he told me I have to come every 6 months. So even at that level, I was still not really getting the kind of information I needed. Most of it was online that I researched myself and not from him. Now, he did tell me, at least in my case, that I was undetectable, my case, and that was a good thing. So that made me feel good, whatever that meant. So my journey here was pretty murky. I felt like I did bounce around from person to person. And what really made me feel even better was more the research I did than anything else. Now, in this case, of course, the barrier here in my situation was that I didn't know where to start when I found out I had hepatitis B. I had no idea what it was. Nobody had ever mentioned that to me, that hepatitis was this, and if you have it, and this is the case, or whether I was an at-risk person because of where I was born or my parents were from. So that was a big problem for me. And of course, lack of information is a big barrier for folks like myself who never hear about hepatitis until we're told we have it. As far as solutions that I think in my case specifically would have been good was my primary care physician would have at least known where to refer me to in terms of information, even something to read to make me understand what I have and what I need to do in order to take care of myself and get treatment. Lucky for me, of course, I had insurance, so I was able to go through these different points of care. And of course, an easy place to access this information will be very helpful. Because the word hepatitis, like in my case, sounds very bad. And of course, tell me B, there's absolutely no way to understand what exactly B is versus A or C or D. So I think that for me would be very helpful.
William, thank you for sharing your case. Does anyone have additional practical solution to share on mitigating barriers to HBV screening and diagnosis?
Yeah, actually, I'd like to share. One, I'd like to point out that the way that William was diagnosed is not uncommon. Unfortunately, sometimes people find out on routine life insurance exams rather than being screened. But I'd also like to point out that William shared some information about where he was born. And based on that, he should have been screened. So one of the barriers is knowledge. And knowledge of who should be screened, and additionally, knowledge of what tests are appropriate to screen for hepatitis B. And one of the practical solutions, well, really two that I'll share. One is to make sure that we ask patients either in person or through some survey where they were born so that we can assess risk. But the other sort of broader and I guess more ambitious practical solution would be thinking about implementing universal screening, because by doing that, you eliminate the need for the primary care provider to know whether or not where someone is born is a high risk area. And so I think those are two practical solutions that would go a long way towards eliminating barriers to screening and establishing the diagnosis.
Yeah, I think so too. But my focus is more because I'm in the community. I see it all the time. And I see how successful we've been is that we are really connected to the church-based organizations and with Department of Health, like here in Maryland, we schedule screening all the time. So if providers are aware how to connect with these organizations, it will be helpful because at least they can link them to care. So I think one of the things that providers need to be aware would be staying connected with the community and know the right places to connect people to.
Yeah, and I would like to add that on top of providers having knowledge about the disease and also which geographical areas the disease is endemic to, I think every time anybody goes in to see a doctor first time, they do have these survey questions that we do fill out. And I think sometimes it just gets messed up because whoever takes the survey enters it into the system and the doctor doesn't go to the system to look at it before seeing the patient. So I think if there is a way that the provider will look over that survey and then go in to see the patient, I think that will help to prevent some of the issues that goes on. Because when that is in the system, the doctor is not going to go in the system and look at that because probably the doctor is in the room with the patient while the nursing staff is putting that information in the system. And so you have that issue where it creates this situation where it's like the information is collected, but no one does anything with that information. Is just collected for the sake of collection's sake. And the purpose why it's collected, it's actually ignored or somehow in the process, it doesn't become effective. So I think one way that I can't stress enough on how much I think providers are stressed out a lot of times, but I think at least just take a minute to go over that sheet to make sure at least you have an idea where the patient is coming from. And then, as Dr. Patricia said, then you can proceed once you have that information to know that this person definitely needs to be tested, especially if you find out where the person is from and then you know that region is endemic to hepatitis B. I think that will solve some of the problem as well.
Yeah. Now, there's one other thing that I'm not sure if we've touched on before or yet is many people in the African community, some are immigrants who are not without proper status. And, some barriers, of course, people don't have health insurance. They don't have the proper immigration status. And so bringing them to the front to be either tested or provided health treatment is difficult. So it's a question of how do we handle, say, even going to church. Someone goes to church, nobody asks them immigration status in church. But, once they are told to go to screening, many folks don't want to do that because of fear of being either discovered or brought into the system, so to speak, and then that could jeopardize their. So how do those people get into the healthcare system, and getting care? That would be something that I have thought about, but I'm not sure how that, can be handled.
I could say I'm with an organization, and all we do is provide health education, screening, and linkage to care to the community that we service here in Maryland, DC, and Virginia. So what we do is we reach out to the churches, and we ask if we can come and do education and screening, and we do. They allow us to come, and we set up big events. Right. And then that events allow the church members to come. So we don't ask for insurance information. What we do ask is other things that perhaps we can find resources to help you. And is that, are you looking for insurance? Do you have insurance? But we don't provide the services only if you have insurance. It's free to anyone. And the great thing about it is if you do test positive, we do link you to care. And so that's type of, I think, services that needs to be looked into more, having the various organizations doing these services for free, and having that be accessible for, especially within the African immigrant community, where people are afraid on their status of, what status they have to stay here in the U.S. So there's definitely help out there. It's just a matter of having it be able to be more accessible to all over the U.S. instead of just here where I help with.
Yeah, I just wanted to add to that. I think it will also, like Jenna said, it will be helpful if the provider identifies a patient that the patient is either doesn't have their legal status, is not in great standing, and because of that, there is this fear. I think what the provider can also do is look into the community and see what resources is available, because we have a lot of organizations in the community that offers these services for free without asking about immigration status and stuff like that. So I think this is where it will be important for the providers just to connect with organizations in the community, try to find out where the resources are so they can just direct some of these folks to those organizations if they think because of some legalities they are not in a position to help the patient. I think those organizations will be able to do so.
Thanks so much to William, Janet, and Dr. Jones, and thanks to you for listening. To hear other episodes in this series, see the show notes or go to the Clinical Care Options website. Thanks for listening.